Global News is revealing new information about Canada's long-term care crisis, including some of the worst-hit homes and who owns them. In Ontario, where almost 1,800 residents died as of June 12th, some privately owned homes were especially hard hit. Almost one-third of those who died lived in homes owned by two corporate chains, Sienna Senior Living and Revera Incorporated. Although many of the company's homes had no outbreaks or deaths, many of those with 20 or more deaths are Sienna or Revera homes. But some not-for-profit homes have also struggled, including Northwood in Halifax, where the virus has killed 53 people. Critics note the majority of residents there live 2 or 3 to a room, possibly making it easier for COVID-19 to spread.
Do we need to have all our nursing homes with single occupancy and a washroom for every resident of their own? That is the question that is really before us here in the province, and it's the question that we need to have before an inquiry.
And joining us to delve deeper on this is Global National's Ross Lord, who joins us from Halifax. Ross, thank you so much for taking the time to talk about this incredibly important issue.
Oh, yeah, thank you. It's good to be here, Anthony. I should say first, before we start, most of that information comes from web reporters Stuart Bell and Andrew Russell. They've been doing the heavy lifting in terms of finding this specific Ontario information, the Northwood angle in terms of Halifax, and that nonprofits are also struggling in many homes. That was sort of our contribution to this.
Yeah, thank you for highlighting that incredibly important work overall. It raises a lot of questions, of course. So break this down for us. What difference does it make whether long-term care in Canada is operated for profit or by nonprofit or public owners?
Well, I think that's what everyone wants to know, because there are so many private owners versus the nonprofits and or public or municipal, as they're sometimes known. The labor unions would say the privates need to get out, that you shouldn't be making money off the backs of seniors who, in many cases, as shown by this pandemic, are not getting the care that they need and deserve, and in fact are dying from the virus. On the other hand, these two large owners, Sienna and Revera, rightly point out, in the case of Sienna, that most of their houses had few, if any, outbreaks, most of their long-term care homes, and Revera saying that data indicates whether a home has an outbreak or not, and the severity of it is not dependent on ownership.
So how much of the problem from the investigation shows is staffing, and how much is the design of these homes?
Well, researchers that we talk to and our web reporters talk to say that staffing is an issue, generally saying that in private homes there are fewer permanent full-time staff hired. So there are more people coming and going, and that there's not as much continuity of care. So that is an issue because on the other side, the nonprofits and the public homes generally, according to people who study this, have more full-time or permanent staff, and so they know the residents better. And so the theory goes that they're going to have better care and be better able to resist something like this terrible virus.
Yeah, but I mean, so many questions, because a lot of people thought that, we were warned to begin with that these deaths should not have happened in the first place. And it leads to the next question, which is, a lot of people are warning of a second wave that could be within us, upon us within months. How prepared are these homes to deal with this?
That's such a great question, and I'm not sure there's a clear answer, because if that second wave comes within months, as many health authorities say it will the homes be any better prepared than they are right now? In the case of Northwood here in Halifax, that NDP leader calling for a public inquiry between now and the fall to identify changes and make them so that that home and others are better prepared. It's worth noting that a lot of these nursing homes are old, and they were designed in a different era. They certainly weren't designed for a highly contagious virus, taking that into account. Some people say that these homes need to be brought under the Canada Health Act to ensure a higher standard of care and, standardization across the board, so that the federal government isn't just giving money to provinces, which are spending them according to their own considerations. Other people, labor unions, say the private should be out of long-term care altogether, notwithstanding what those companies rightly pointed out. More staffing, more permanent staffing, these are all things that we hear about, and we did ask the federal government about this. We have asked them, and Deputy Prime Minister Chrystia Freeland recently told us that, adamantly, that they are going to fix the problems. We have yet to hear specifically what the federal government plans to do about it, though.
Well, a lot of people holding them to account. A lot of people obviously looking for answers. Ross, thank you so much for all of your work on this investigation. We really appreciate it. That's Ross Lord joining us from Halifax.